Today we are going to discuss the remaining part of the heart, that is after the completion of the introduction of the heart and explanation of the right atrium. We are going to deal the today explanation of the right ventricle, internal structure and features of right ventricle, and the features of the external and internal features of the left ventricle. So, my dear students, we have to explain as the ventricles in the total 4 chambers of the heart. We have the right ventricle. This is the outline where you can see the right ventricle. This is you are going to get, and this is the chamber which is you get the left ventricle. When we study the right ventricle, so right ventricle you have to tell it is one of the triangular chamber which is present in the anterior aspect of the heart. As it is a triangular in shape, so it is forming the sternocostal surface and diaphragmatic surface. So that almost all the sternocostal surface and diaphragmatic surface are formed by that is a right ventricle. Also it forms the inferior border. In this you have to mention what are the points we have to explain in the external features of the heart. In the external features of the heart, as you get this is all triangular in shape of that is the right ventricle. Then this right ventricle, it is receiving the blood from the right atrium. This is the right atrium which pumps the blood into the atrioventricular orifices, that is the tricuspid valve. That is the blood coming from the right atrium to the right ventricle, and that is the entry of the blood which enters into that is the right ventricle. In this you have to explain the first part, the triangular chamber which is anteriorly forming the sternocostal surface, inferiorly diaphragmatic surface, inferior border, and as the blood from the right atrium entering into the right ventricle, and this right ventricle that is reaching blood from the right atrium by this is a one orifices which is, you can remember, it is the tricuspid valve or the right atrioventricular orifices. Then I have told the blood entering into the right ventricle. This right ventricle which pumps the blood to the pulmonary trunk. This is a pulmonary trunk which is, you can see, it is a pulmonary trunk. And these are the valves which we are going to get. These are the semilunar valves. You are going to get that is a semilunar valve. You can see semilunar valve which you are going to get in that is a semilunar. There is a cusp like which you are going to get in the pulmonary trunk. So 2 types of orifices, atrioventricular orifices and semilunar orifices. That is semilunar orifices comes in the pulmonary trunk as well as the aortic orifices. Okay. So first in this you have to remember it is forming sternocostal surface of the heart, inferior border, and I have told it is also forming the diaphragmatic surface. Then going to the internal structure of the right ventricle. So internal structure of the right ventricle, how you have to explain? You are going to get that is a inflowing part is rough and the outflowing part is smooth. So you are going to get in the internal structure of the right ventricle that is it is divided into 2 parts, inflowing rough part and outflowing smooth part. This inflowing rough part which consists we call as a trabeculae corneae. These all rough part which are seen here, these rough portion of the heart inflowing part, this is known as a trabeculae corneae. So you are going to get the trabeculae corneae, that is a rough part. Then that is divided, this all is divides into that is again into consisting of the chorda tendineae. So you are going to get the chorda tendineae we are going to get the elevated part which we are going to call as a bridges. So one end is attached to the elevated part, fixed elevation, that is we are going to call as a papillary muscles. We are going to get papillary bands, and the elevated part which we call as that is the chorda tendineae. So chorda tendineae are the bridges. So rough part which consists the trabeculae corneae, This trabecular cornea consists of the three parts: ridges, bridges, and pillars. So ridges are those which are the fixed elevation, and bridges are the which is connecting to the one end to the cusp and another end to the papillary, that is a papillary muscle. So that tendon, which is, you can see this is a bridge like thread like connected, and that is we call as a chorda tendineae. So chorda tendineae are the bridges. Then we have the fixed elevation are the ridges, and that is the rough part of the interior of the right ventricle. And we are going to get the here papillary muscle, papillary bands. We are going to get anterior, posterior, and septal. Three papillary bands which are present in the that is a right ventricle. So whatever the you are going to get, these are the papillary bands, which is you can get on the anteriorly. This is a papillary band, anterior. Then we get the posterior, and one is a septal. Septal in between the ventricle. Right and left ventricle separated by the septal wall. That is how we get the septal. Then next you have to explain what are the openings inside the right ventricle. You get the first one, that is a right atrioventricular orifices, that is we call as a tricuspid wall. That is a blood, deoxygenated blood coming to the, that is a right atrium. Right atrium pumps into the, that is a right ventricle. Right ventricle receives the blood from the right atrium through the, this is the one which is a right atrioventricular orifices or the tricuspid wall. Then blood enters into the right ventricle. Right ventricle pumps into the pulmonary trunk. So this is the one which is you have to trace into the pulmonary trunk. And this deoxygenated blood from the pulmonary trunk going to the lung for the oxygenation. It divides pulmonary trunk into right and left pulmonary arteries. Okay. So this is the one you have to remember about the triangular chamber. It is forming sternocostal, inferior surface, diaphragmatic surface, and inferior border. And most important, blood received from the tricuspid wall, from the right atrium to the right ventricle. Right ventricle pumps into the pulmonary trunk, that is going to the lung. So this is the main important points of the right ventricle. What is the difference between the right ventricle and left ventricle? So right ventricle, you are going to get it as a triangular chamber, and left ventricle is a elongated chamber. Then right ventricle wall, when you see, this is a 1:3 thickness. See, thickness of the left ventricle wall is thicker. That is a 1:3. That is a 1:3. 1 mm is there, or 1 mm is there means it will be the 3 mm. So the wall of the right ventricle is thin than the left ventricle. Then you get the almost all the in the right ventricle forms the sternocostal and inferior or diaphragmatic surface. Left ventricle, it forms the sternocostal surface, diaphragmatic surface, left surface, and both are forming the inferior border. Next you have to remember the almost all the right ventricle consists the deoxygenated blood, and left ventricle consists of oxygenated blood. And we have the three papillary muscles, anterior, posterior, and septal, and one moderate band in the right ventricle, and left ventricle, which is consists the two moderate, that is a papillary bands. So that is the anterior and posterior. Then right ventricle has the inflowing rough, outflowing smooth. Then they are separated by interventricular crest. Then in the left ventricle, lower rough and upper smooth. So this is the way you have to remember about the difference between the right ventricle and left ventricle. So apex of the heart is formed by the left ventricle. Sternocostal surface, inferior border is formed by the, that is the, we have the, that is a right ventricle. Okay. So with this you can understand the, from the right ventricle pulmonary trunk is arising, and from the left ventricle we are going to get the aortic orifices arising. So aorta is beginning from the left ventricle. So these are the points you have to remember in the, that is difference between right ventricle and left ventricle.